Good evening, everyone. Thank you for joining us at BirchBark's webinar, education webinar. I'm Dr. Mary Ann Birch, the founder of BirchBark. And those of you who don't know about us, I can quickly tell you we are a nonprofit organization that's just about 10 years old. And we have three missions that we work on. The first is pet aid gifts. So we work with the local veterinarians who discount the bill 25%. Owners come up with 25%, and BirchBark pays 50% when they are good prognosis medical emergencies for low-income families. So the families do have to qualify economically. We also have a pet loss support group and no-cost service for helping people go through the process of grief when they lose their pets. And then our education webinar, which is what we're doing tonight, which is helping pets and their people be better advocates for one another and maximizing the human-animal bond. And I'm very excited. This has been a topic I've wanted to have on our webinars for a while. We have Dr. Lissa Richardson, who's going to talk about pet first aid this evening. Welcome, Lissa, Dr. Richardson.
Thank you. Thank you very much. And welcome to you all. I'm in Walnut Creek in the East Bay here, and very happy to be allowed to present to your foundation. You have been truly an inspiration. I'm going to put on my, share my screen here and get going.
Oh, I should mention to everyone, there's a Q&A button at the bottom of your screen. You can and you can use that to ask questions, and I will relay them to Dr. Richardson.
Perfect. Yeah, I think so. Should be watching that, and if questions come up that are pertinent to what we're talking about, we'll interrupt and do that. Some others that are more scenario product information we'll do at the end. But yeah, this is first aid for your pet when you are out and about. And again, I'm Dr. Richardson. I'm one of the surgeons with Sage Concord. Sage has 5 locations in the San Francisco Bay Area that are all specialty and emergency. So I went to vet school at Colorado State and did most of my surgery training in New York City. I did internship and residency there, and then came to California to teach at DACVS for 2 years, and then I've been a surgeon at Sage now for 29 years. So it started as Veterinary Surgical Associates and has become Sage. So I've also had a lifetime of practice doing first aid to pets. So I've camped with animals ever since I was old enough to go camping, car camping with my family. So a lot of this comes from personal experience as well. I do a lot of some speaking, not a lot, but I talk at Cover Your Canine on first aid there for police dogs, and REI, some wilderness medicine. I speak at the Sage Symposium, and I love to go to schools as well. And I'm also founding board member of Sage Compassion for Animals. So we have a similar purpose as the BirchBark Foundation, but we work in the Bay Area counties up here of helping low-income people with a medical crisis for their pet to afford the care. So I'm very, and the BirchBark Foundation has been instrumental. We learned a lot from there and trying to share good practices. So it is an honor to speak to this crowd, and thank you for supporting that, because it is huge. So I developed this talk with other Sage doctors, in particular Megan Davis. And so it's kind of morphed through the years, but it's not solely my own talk. I don't have any financial interest in any of the products that are mentioned, and it's truly for information only, not medical advice for your pet. And we discussed a little bit about the questions. So what we'll cover is first aid kit suggestions, the vital signs, what's normal for your pet, our secret sauce in how to hold an animal so that you could administer first aid, some injury prevention tips, how to stop bleeding, how to clean wounds, limping when you worry, some bandaging basics. Bandaging is tough, but quick overview here. Heat stroke, probably one of the biggest things that can go wrong quickly in dogs and super easy to head off. Snake bites, skunks, and fish hooks. So first aid kit for adventures, and I will share, so after the talk, we will send out to those who participate in the talk a first aid kit, a little brief summary of what was covered, but not the exhaustive talk, but the first aid kit will be in there. You know, you have to modify it to your needs. Is this something you're carrying in your car? Are you just going for a day hike? Is this a backpacking trip? But leashes, poop bags, some first aid tape, vet wrap, boy, super helpful, some bandaging materials. When I'm going to be away from civilization for a while, I always take Benadryl. Thermometer, not a bad idea. Honey or Caro syrup, that's really if you've got a diabetic. And eye ointment, you can ask your vet for eye ointment or an anti-inflammatory, again, if you're going to be away from civilization for a little while. It's not a bad idea to pack. This is the brief bandaging material, probably one of each of these things that you've got, something that's nonstick. As you know, you cannot put a Band-Aid on a pet. The fur just doesn't let it stick. So we're left with wrapping. And the wrapping also provides some compression. So these are the articles I carry in the car camping kit. And then at home, probably the one thing that has kept my pets personally out of the veterinary clinic is a good pair of clippers. So get a good pair. You're going to spend 80 bucks, maybe 100 bucks for these, but that is less than the price of an ER visit, right? And 40 blade, so that any of these wounds that you get, you can just clip them at home and clean them and not have to go in, because it's the hair and the matting that really gets the dirt to stick in and lead to infection. I also like to have an antiseptic spray, so either Vetiricin or Microcin AH are my favorites. The hydrogen peroxide and baking soda are as if you're in the skunk area, and there'll be a recipe for that coming up. And then I keep an Elizabethan collar or a cone in the house. It's like a talisman hanging in my garage, because I know the moment I throw it away or recycle it, I'm going to need it. And speaking of the cone, ever since the movie Up, right, that it was the cone of shame. But no, right, we're going to rebrand this. I'm slowly rebranding this thread. It is now the halo of healing. Because honest to goodness, you keep that thing on for 2 weeks, you're going to heal beautifully. The moment they start to lick, it slows down all the good work your veterinarian just put into that. All right, so dog normals. This will be on the handout, but do know that dogs and cats run hotter than we do. So 101 to 102. They're smaller, so they're going to breathe faster. They have a higher metabolic rate. Gums should always be pink, right? You can look at a person, tell when they're going to be a little pale, but animals, you're going to have to lift their lip and look to see if they're pale or really injected. Do know that cats normally do not pant. The big cats do. See the tigers in the zoo, the lions. Our household domestic short hair, domestic long hair, if they're panting, that's a respiratory distress. And that's not normal. So they pant with heart failure, a few other things. So assessing your pet, it's not so much, it's both for you learning how to do this, but also for your pet being assessed. Feel their heartbeat, reach for it. So if you're going to get the heartbeat, you're going to squeeze behind the elbows or put a hand on either side if you've got a big one. And the femoral vein is tucked up inside the rear leg, right where the leg meets the body. It's going to take a while to feel it. And in a panic, you're going to like, I can't feel it. Is that because it's me or it's not there? And so the more often you reach for it, just when you're doing your normal petting, it's like, oh yeah, there's the femoral. I got it now. And that's a little diagram of where it is in the muscles, but you're just going to have to feel for it with your finger, not your thumb. Assessing your pet. So you can count the number of breaths per minute by counting them in 30, 15 seconds, whatever, and then multiply. And do take it at rest, not panting. So one of my favorite little movies here. So checking for dehydration. How can you tell when your pet's dehydrated? Well, we veterinarians use the skin turgor test. So you pinch the skin on the back of the neck and watch it fall into place like this. This is my dog Pepper. My husband testing her. Pepper's like, what the heck are you doing? But this is normal hydration. That skin snaps back normally. As pets get dehydrated, the skin doesn't snap back so quickly. So if they're mild dehydration, it kind of slowly resumes its normal position. Super dehydrated, it's going to stand straight up tented, kind of like my hand on the other slide. So old age, you can have decreased skin turgor and you can pinch and it'll stay up, but that's people, right? Pets, it should snap right back. All right, so when to worry? Big ranges. So temperature less than 97, greater than 104, that's a big range. You can take a temperature using a rectal thermometer. You can use a standard rigid rectal thermometer. I have one at home. I took a Sharpie and wrote big dog on it so I wouldn't mistake it for one that I wanted to put in my mouth, although you can clean it. And you take a temperature, put a little lotion on it or some Vaseline, something like that, and put it in the anus, about an inch. They don't have to go in very far. Press the little button and typically you get your temperature pretty quickly. So a heart rate variation of 20 beats more or less than your pet's normal. Again, your pet's going to be different. We give normals here, but it all depends. A Chihuahua, much different than a Great Dane. Respiratory rate, greater than 60 at rest or when having difficulty breathing. So that we can kind of generalize. So when you're having difficulty breathing, often you see the belly working to breathe. Normally it's just the chest muscles and you can just see the chest rise and fall gently. When the abdomen's working to breathe, that's when you've got a problem. Or dehydration. So fever, increased respirations, dehydrated. Do know your pet's medical history, especially any major problems. You know, when you travel, camping, whatever, you can keep a little sheet of what it is so that when you go to an emergency clinic that doesn't know you, you've got it. Do know your medications and supplements, and figure out where you might go in event of an emergency. So if you're headed up to Reading, it's like, ooh, what's the pet emergency clinic situation there, so that you know where to go. Do not give over-the-counter medication without consulting a veterinarian. Tylenol will kill a cat. It's okay for us. It's actually okay for dogs at a certain dosage. Aleve, the common non-steroidal anti-inflammatory for people, very toxic. It takes a couple days to work its evil ways, but not appropriate for dogs or cats. There's lots of different things like it. We are so different metabolically that it is not safe to assume that an over-the-counter human medication is going to be good. Other tricky thing that sneaks in is xylitol. So xylitol can be a sweetener in some medications. It's also a sweetener in sugar-free gum, very toxic to dogs. And don't believe everything you see on the internet. You really do have to take it with a grain of salt or check it out with your veterinarian. All right, so dogs hurt. They can bite when they're in pain. You cannot take care of your pet if you've just been bitten badly by them and your hands don't work. So things that you can do, you can try and put on any collar if you're at home and have that, like me, in my garage, or you put a muzzle on. Any kind of length of rope will do just fine. And there are techniques where you loop it around the top, cross it underneath, and then behind the ears, like this diagram is saying. Some people keep cloth muzzles at home or in the car, especially if they have one that might bite. And then this is showing just using a disposable, a leash, a rope leash that you can loop around the muzzle. And then of course, my favorite for the brachycephalic dogs, the short-nosed dogs, they have wonderful muzzles. So these dogs can't bite, but they can see and they can breathe. You may want to buy one just to have. So our secret sauce is in the hold. So two things. When the dog is standing, what you want to do is your dog needs to feel you there. So you need to be next to your dog. And just like in this diagram, this woman's arms are wrapped around the neck here. So you're going to keep the dog from, suddenly whipping around and biting. And then you're supporting the dog with your arm around the waist. So they feel close and held to you and secure. This way you can examine the dog standing. If you need to lie him down, every one of these things is important here. So they lie down and your arm is across the base of their neck, not across the throat. Don't want to choke them. And you grab the bottom paw, that bottom front paw. If they cannot pull that back to get up, they won't be able to get up. You grab the bottom front paw and then the bottom rear paw. and this will keep a dog on its side. Now, some are super wiggly, and if they're very painful, super anxious, you may not be strong enough to hold it, or you may get bit trying to hold it. So, be smart about it. But this is how you hold a pet on its side, the down front paw. How to lift your dog. It's going to be a basic tuck. So emergency transport, say you can't pick up your dog. You're out camping, dog's got a broken leg, and it can hop on 3, or maybe it's heat stroke, you need to take it out, it's not being able to walk. You can take any 2 jackets or a sleeping bag, and you put poles through them, so hiking poles, branches, and then you zip the jackets together, and now you've got a sling. You can even use the arms of the jacket to tie over your pet to try and keep them on there. This is going to take 2 people to carry, like you carry a stretcher, but you're making a stretcher for these dogs. If you don't have a pole, you're going to need to use a blanket, a sleeping bag, and just put the pet in the middle, and people hold the corners of it to carry them out. Wrapping a cat. So I thought, I'm going to show the steps. And I got a friend of mine and told her how to do it. And it was a whole failure. So I have a cute little pictures, and then we could never get them wrapped. So I had to end up wrapping a stuffed animal here, because it's hard. But if you can wrap your cat at home, make a kitty burrito, feed him a treat and let him go, and do that a little bit, then when you have to give medication or look at them, like you put them in a burrito and then stick out a paw, they're going to be used to it somewhat. So I highly recommend practicing making a kitty burrito with your cat. And it's basically wrapping them in a towel. So we've got how to do that on our website, the Sage website. And then there's a couple online guides. So I went through a bunch of different videos. Mostly people get it right. Some videos are very, very long, but you can watch a video on how to wrap a cat or make a kitty burrito. Our Pet Health is good, and Vet Street had a good one. We can go back to these if we have a lot of time, but I don't want to waste the time here. We're going to keep going. Prevention, the leash. Oh my gosh, it is your cheapest insurance policy. If there's parks with cars and lots of other dogs, a leash is your best prevention. And then with heat stroke, just don't go out in the heat. If you find yourself going, gosh, I wonder if it's too hot to take the dog for a walk, it's going to be too hot. If you have to think about it, especially the brachycephalics. Go out and test the pavement. Put your hand on the pavement. It's too hot for your hands. It's going to be too hot for a walk. Don't go on a walk. Come back at a different time. People ask me about seatbelts in cars. There is nothing tested. There's nothing that anyone can say that is recommended over the others. I have seen pets come in that have been in car accidents, that have been bounced all around the car. They don't do well, just like the people don't do well. The ones that seem to do better are the ones in a crate in the car, with a crate lockdown, so they can't move around as much. I will sometimes put my pets in a seatbelt, but do I do it always? No. And it's a harness and a seatbelt. But they do get launched, and they do go through or hit windshields. So I don't have a strong recommendation, but what I've seen is crates. The pets in crates have been better in car accidents than the ones that just flop around the car. All right, so let's start with the thing that when it gets cut, bleeds a lot, and that is the ears. So, the dog get a cut on their ear. What do? They shake their head, and the blood just goes everywhere. So the quickest way to control the bleeding, if you have a gauze sponge, great, but a sock or a knee high, cut a hole in one side for the good ear, and you put it over the dog's head to hold the ear to the head and just limit the amount of flapping that they can do, and get to a veterinarian where we'll probably sedate them, clip it, clean it, and stitch it. If you've got some dogs will immediately, once you put the thing on, paw it off. So you need to put a cone on them, or use your first aid tape in your first aid kit, and you can actually tape the sock or the knee high to their fur. You can put a full bandage on if you have full bandage material, but really just taping that ear down. This is my dog Pepper. Very tolerant of me doing my demonstrations on her. And there's just, the way you want to put the ear under the wrap is the way the ear normally sits. So if the dogs have floppy ears, the ear should be down. Dog has upright ears, you want to put it onto upright against the head. Bleeding tail, so that's the other thing. Dogs with happy tail, or they get their tail stuck in someone closes it in the door, yuck. You can put a sock or a bandage over it. You can wrap a little bit of first aid tape, and then to keep it from wagging, you tape the leg, the tail to the leg. Once it's there, you can apply some pressure, feed them some treats or someone to distract them. You'll hold pressure for 5 minutes, and this gets you a little time to get in the car and get to the vet. Of course, if you're going to be out for a little while and they need to go potty, you're going to have to cut the tape for them to go to the bathroom, to defecate, but then you can retape it back. And again, in both of these circumstances, don't bother with clipping. Just get some pressure on it. Let's get the bleeding to stop before worrying about the clipping and the cleaning. So some common injuries we see, especially out backpacking, hiking, are the pads feet. They're really the pads in the paw. So abrasions are pretty common. Those are treated really with rest. You can put some cool water on them, maybe some salve or cream. There's Musher Secret, Burt's Bees nose and paw ointment I like, but even just Aquaphor is going to be okay. And then put the cone on so they don't lick these things. If you've got a pad laceration, this is going to need veterinary care. You can't even just bandage these, because every time the dog walks, that pad just kind of spreads out and these things pop open. So these really do need stitches. So this would be something to bandage, put some pressure on first, 5 minutes of pressure, and then put a bandage on and get to your veterinarian. And interestingly enough, the pad lacerations tend to not bleed quite as much as the paw and the ear. They do in the beginning, but that fat, there's a lot of fat and kind of gristly like stuff under the pads that doesn't have as much blood supply as the other parts, so it tends to stop relatively quickly. So paw cleaning at home, if you have that abrasion, if you want to clean a laceration, the best way I find is to use plastic baggies, and you lie them on the side using the secret sauce hold, and you put warm water in a baggie and you put the paw in the baggie, hold it pretty snugly, and then you can kind of squish the bag like a little jacuzzi. And this is so much easier than trying to get them to stand in a bucket of water or to use a handheld shower nozzle or to come at them with washcloths. And this really can get at a lot of the dirt. And then you put the soap in there, and you empty that out, and then you can rinse it with warm water a couple different times. It's kind of messy. You have to put a towel down. I did this out on the wood deck. So it's great when you're out and about. But if you're doing this in your don't do it in your living room. So kitchen floor, bathroom, something where you can clean up some water. And then you put the cone on, or halo of healing. Do you know that when you get a foot laceration that's above the paw, this is pretty common. So this is where all the little arteries and tendons are. What happens with the arteries when they get cut is they retract and they spring up. So you've got a cut, you've got to do that here, but the arteries further up. And so as you apply pressure, so you got your dog down on their side, someone's helping hold, and you apply pressure while you're asking someone to get the bandage material. You're not going to hold just at the cut, but a little above that as well. It's not going to retract more than half an inch the most, depending on the side of your dog, but it does retract a little bit. So you want to be able to hold pressure there as well. Some of these are really bad, and you can have dogs that bleed out from these wounds. And so it is often a two-person job to continue to hold pressure while you get bandage material, and then even try to hold pressure after you've got the bandage on and someone else to drive. You need to call a friend for these. All right, so limping. The rear leg is usually pretty easy to see, but what can be hard is to assess the front leg. The thing to remember is that down is sound meaning good or okay. So when a dog is limping, when they come down hard on a leg, that's their good leg. And their head goes back when they put the painful one, and then down is sound. So whenever I watch a dog for a lameness exam, you kind of see me, my head bobs up and down. And I'm going to do this kind of fast. And then I have a dog that's a little slower. I see people like, oh yeah, she's limping, but where? I'll do it one more time. Oop, come back here. See, she's lame on her left front because she's coming down harder on her right front. So here's another one. Up, down, up, down, up, down. Up. So lame on her left front. She's good on her right front. Her head's coming down when her right front hits the ground. She's a sweet old girl. So again, the rear leg is a little easier to see. The right, with the exaggerated movement of the head, really throws us off. And so people come into the office like, oh, she was limping. I don't know which one. It's pretty common. But see if you can do lameness exams on your dogs or even the others that you see out and about. All right, so a dog limps because it hurts. A lot of people say, oh, not in pain, dog just limping. Well, no, they hurt and they don't want to use that leg as much. You know, it's like you twisting an ankle maybe. It hurts, and so you don't put your full weight on it. You're not going to cry out every step, but it hurts. So if a dog is using the leg, like the first two, so the first one was my border collie, and she had just had a big day at the pool and had a couple paw abrasions. The other one, the older dog, had arthritis. So those dogs, that's a moderate to mild pain. And if you're hiking, you know, maybe take it easy for a day or two. And these are common, foot pad injuries, a little strain, a sprain. So take away any weight if they're carrying a backpack, cut short the hike, maybe put them on a leash because they will not limit themselves. They'll still run around like a crazy one if they see the turkey or the squirrel or whatever, and pick them up if they're small enough. Treat with rest. If you can find the painful area, cold pack, consider some anti-inflammatory medication. If it stays, go talk to your vet. Now, if they are not using the leg or they're just toe touching it down, that's when you need to be, the hike, the trip, whatever should be aborted, and you should go see your veterinarian. This dog had torn a cruciate ligament. Other things with skin wounds, so we're kind of moving our way up the body. This is where you're going to get your clippers. They let you. Hopefully you've actually habituated them to the sound of the clippers. That's a good thing to do, like practice wrapping your cat. Turn on your clippers for your dog and give them a treat. Clippers, treat, clippers, treat. Clippers to the skin, treat. Get them used to that sound. Clip it and then clean it with some soap and water. Just regular hand soap is fine. If you can cover it with a light bandage, great. If not, leave it open, but it depends on the size. This one is a little bit of a bite wound. You can probably just treat that with a little Tirocin in a cone. Bite wounds, punctures, they have more risk of infection because the teeth going in, and they can be hidden by the hair. For all bite wounds, seek a veterinarian care. Before you get there, if you can clip, clean, and flush it, great. But the problem with bite wounds is that the puncture is really just the tip of the iceberg. So often there's the bite and then there's the shake. And it's that shake that can destroy muscle underneath that you don't even see, or tear a lot of the skin off, not so that it's a wound, but from its blood supply. And sometimes we see the effects of that many days later, where the skin gets dead, dry, yucky. Now, lacerations, all depends kind of where they are and what. This one looks really awful. It was very superficial. Caught it on a nail, it kind of peeled the skin back, but it's not deep at all. This kind of thing, you're going to want to put something that's just going to keep the wound moist. So water, saline in a gauze, or KY is okay. That's water soluble. Don't put any antibiotic ointment. The oils are hard to clean out. Cover it so you can use a little tape. Maybe put a shirt on this dog while you get it to the veterinarian, because this is going to need to be treated. Value of a clean towel in your car. So this poor dog got attacked by other dogs and actually has some of the fat and intestine material coming out. Something like this, you can just rinse it off with your water, a water bottle to get the dirt off. And then if you've got a towel or someone's shirt, wrap it around the dog. You can use duct tape, safety pins where you're just pinning the fabric together. But get this covered before you bring, if you can, and bring them in. All right, so now you're thinking, this is unfortunately a break where the bone actually went through the skin. So this is not only dangling, but you've got bone exposed. So rinse this with water, put a non-stick pad, and let's go ahead and put a bandage on to both cover that wound and to try and keep things from flopping around a little bit. Typically, we bandage the whole paw. So even if it's further up on the leg, keep the paw bandaged, because otherwise you can get a swollen paw. So bandages can be dangerous if too tight. So we're going to want a bulky padded bandage. Sometimes people just use their sweatshirt and duct tape, and that's okay. So you've got a primary layer that is the topical wound. Secondary, that's your bulk. And then the third layer is the gauze that kind of tightens that down. And then sometimes you'll have a nice outer layer of the vet wrap. So first layer to the wound, if there is one. Second, bulky cast padding or a sock or a shirt. Third, the cling gauze. And fourth, the tape, the vet wrap. So I'm gonna go through this pretty quickly here. Check my time. This is what we do at the vet clinic. So you can see how we do. We put stirrups on. You don't necessarily have to bother with this. This is going to keep the gauze from sliding off. You put tape to the skin. There's our telfa on top of the wound. We're going to start at the bottom and roll the cast padding up about 5 or 6 times, not just one, 5 or 6 times. And then we come with the cling wrap. And then we pull the tape apart, twist it, and put the tape onto the bandage itself. And so it's like the bandage is the foot and the tape is the stirrup. And then we put the vet wrap on, not tight. The stuff needs to lay down. The stuff is so stretchy, you can really cause a lot of, get your bandage too tight. So if you have swelling, you're going to see the toes separate, which is what this picture down here is showing. And if that is happening, your bandage is too tight, take it off and start again. If you have blood soaking through or if the bandage gets wet, all these needs to be changed in 24 hours. These are all things you're going to hear from your veterinarian if they are the ones putting on your bandage. Again, quick bandage for a paw, use a sock instead of bandage material, and then try to get some kind of cling or a knee high. I put knee highs in my first aid kits, and then some white tape. Dogs will chew, so put the cone on. Bandages can cut off circulation. Wet bandages can increase the risk of infection, and if improperly placed, you can lose blood supply. And so if you are like, I can't do this, it's okay, don't, because they can cause worse problems than you're trying to treat. I love this diagram of, we have all the same bones as a dog, except dogs don't have a collarbone. But I love this diagram because the arm bone and the thigh bone are almost part of the body. You can't get a bandage around it. The only bones you can really splint are the ones below the elbow and below the knee. People carry SAM splints for themselves. These are closed cell foam around aluminum. These work great. And this person is demonstrating how to put it on with just some tape to keep some, maybe there's some broken toes in here. And that's going to be fine temporarily because now you can see everything too and see if it's swollen. I've also splinted myself with a tent stake. You can do it with a dog, just be careful it doesn't poke in. Blankets, branches, pillows. You can use a towel like a splint. Now they're not going to be able to walk on this. This is if you're going to carry your dog out because it's otherwise going to come straight off, but something bulky around there and put a little pressure on it. All right, burns. Dogs can get sunburn. My dog gets sunburn on her white nose here every summer. So we put a little sunscreen on her nose. Probably the biggest, and like any burn, just get it cool and then keep them from looking at it. Biggest worry we have is heat stroke. this happens fast. And our poor little short-nosed dogs, it happens even faster. But dogs at risk is anybody, but also if you're overweight, heart murmurs, there's humidity, poor ventilation, or you're getting dehydrated, those increase your risk of getting heat stroke. And our poor little smush-faced dogs is because the skeletal structure has been shortened and all the soft tissue structures just as long. And so their soft palates go all the way down potentially into their laryngeal openings, why they snore. And there is no such thing as a dog that normally snores when it breathes. It's always a problem. Now, dogs don't lose heat by sweating, they pant. But if you get their coat wet, they can lose heat through a wet coat. Dark dogs absorb more heat. And really, if the air temperature is below 89 and the dog's at rest, the heat can be lost through some radiation. So there's different ways, panting and radiation. Signs of hyperthermia or heat stroke. So heavy panting that continues once they're stopped and are at rest. They're a little agitated, high heart rate. This is when it's important to kind of know your dog's heart rate, that greater than 40. Bounding pulses in a dog that seems to be kind of slowing down. A dog is drooling. Again, the body is trying like crazy to get rid of the heat. So it's sending more moisture to the mucous membranes here to get that evaporative cooling. Not obeying commands, staring or staggering, collapse and seizures. You don't want to wait till the seizure. You want to be catching them at this not obeying. So if you're just like, oh, my dog just seems a little off, that's it. Time out, stop, rest, get in the shade, get water on them, ask people for water, put it on the dog. It is time to stop and rest. If they're getting to where they're vomiting and have bloody diarrhea, it's almost too far. Brown urine, we're at the very end zone here. You can carry a thermometer. It's not hard to do. And if you have a rectal temperature greater than 105, time to stop. I'm not going to show this video, but this was basically a police dog working in Florida, and he just stopped obeying the commands as quickly. Now, officer shut it down, took him to the vet, and the dog's temperature was 107. And this one survived, but that's all it was that he noticed. That dog had severe heat stroke. Bad things happen. Basically, the body's cooking. We don't want that to happen. So you stop all activity, wet the skin, let them drink water. Careful with the ice pack, not all over, maybe a little groin in the armpit. You don't want to drop the temperature. Sometimes that can harm the skin. And when the temperature comes down to 102, 103, you stop your active cooling. So no more adding water, no more ice or anything like that. And get to a vet. So a study was done showing that if the survival was 83%, it's still only 83% if you can get dogs to a veterinarian in less than an hour and a half. So just take them in and stop all activity. All right, so snake bites. We have rattlesnakes here. The enzyme, the venom contains an enzyme that breaks down tissue. It thins the blood too, and cause some neurologic signs, kind of stupor. And the signs always depend on the amount of venom, and you never know how much venom is going to go there. It's injected at the site of the bite. If you're not sure that that's where a bite was, use your handy dandy clippers and clip and look for 2 punctures. Typically, the baby rattlesnakes are the most worrisome because babies haven't learned yet. The smaller the rattlesnake, they haven't learned to not release their venom. So the older rattlesnakes, they know that the dog is not prey that they're going to eat, and so they can give a dry bite. Babies haven't learned, don't have the experience to do that yet. I talk like they go to school, but I don't know how it is, but typically the babies are a little bit more worrisome. What to do? You keep your dog calm. So you pick them up, you stop all heavy activity. You're trying not to increase their heart rate, get the venom circulating. Do not put a tourniquet. Do not ice it. And don't use any suction device. Do not be a hero and try to suck it out with your lips and spit it out. Not going to work. you really just need to get to a veterinarian. You can clip and clean it, and they're going to give pain medications because it hurts, and they have or should have anti-venom. There is a vaccine. No, the effectiveness, the ER vets I talk to say it seems to help. So my dog was pretty stupid with snakes, so I got her the vaccine. It's better to learn if you can teach them the aversion so they don't go near snakes or have a real good recall. But sometimes they don't even see them and you don't see them. Most dogs survive. If you're bit in the face or the eyeball, most of them don't survive. Face, we have a harder survival time, it's just closer to the brain, but most dogs survive the rattlesnake bites. Skunks, just a nuisance. If it gets the eyes, it's irritating, but it's not going to give you a corneal ulcer. So rinse the eyes with some saline and you bathe them. This is my favorite mixture, is the hydrogen peroxide, baking soda, Dawn dishwashing liquid. My little pro tip is to wash the whole dog, but do the head and ears last, because that's when they start to shake and share their whole bath with you. So I do that at the very end. Allergic reactions. So bee stings, probably the most common you'll find out and about. Dogs can get hives. It's hard to see hives on long-haired dogs, but that's what hives look like. Or dogs with a puffy face. And this is one over-the-counter drug. Feel pretty good about, it's pretty safe, innocuous if you think they're having an allergic reaction. They're still alert, right? They're not anaphylaxis. It's Benadryl. Make sure it's plain Benadryl, not Benadryl cold and flu. And it's 1 milligram per pound by mouth every 8 hours. So your average 50-pound dog is going to be 2 capsules. If you're not close to a veterinarian and you've got hives or swelling of the face where the dog's otherwise okay, you can get this. I put this in, this is kind of prevention, trying to pull 2 dogs apart. Safest way is going to be the grab behind legs. Don't get in the middle of the bite. You've got 2 people, coordinate it, grab behind legs at the same time to pull them away. You can startle them, use water, stick, pepper spray, but boy, just don't get in the middle of it. It's hard not to do, People don't think straight. I don't know if I'd think straight, but that's the best way. And then I'll end on this, the fish hook. Tell all your friends, if your animal, if your dog, cat ingests a fish hook, do not pull the fish hook. Let it go. Cut the line short. You're going to need a veterinarian to help you get this out, but cut it short so they don't pull on it or step on it or anything like that, and take to your veterinarian immediately or within a few hours. Because if you pull it, you're going to set that hook and it's going to be much, much harder to get out. So if they just swallow the fish hook and it's in their stomach, our internist can use a scope and go down under anesthesia, take the hook, and we can pull it back. But if you pull, you're going to set it into the esophagus or the stomach, and then you're going to need a surgeon to go in and take it out. It's going to be 2 to 3 times the cost, recovery time 2 to 3 weeks versus a day. So it is super hard, but just let them eat the hook. Do not pull a fish hook. And that's it. There are a few other places to find some veterinary first aid. It's not easy. Some of these places I've gone and it's like, oh, no more classes. I do like the first aid app, Pet First Aid app that's put out by American Red Cross. It's pretty good. You can download it onto your phone. But you do need cell service, so it doesn't help you if you're out backpacking. All right, that is it. Hope everyone is still awake. Your homework is practice assessing your vitals, practice doing the secret sauce hold on your pet or a kitty burrito. Give them tons of treats when doing it, and familiarize your pet to the halo of healing. It's a great thing to put on puppies and your cats. Take it on, take it off, take it on. It's part of life. And then the sound of clippers. That is it. I'd be happy to take questions, comments.
That was wonderful. I really enjoyed that. And I'm surprised we haven't had had questions. So people who are out there, you can ask a question through the Q&A or through the chat. It may be that Dr. Richardson was so thorough that nobody has any questions. So this is a good opportunity if you do. There's a lot of really good tips in there. That was great.
Yeah, some of them hard won by myself with all the different pad injuries. Yeah, I've never had to splint one of my own pets out on a trip, but I've definitely splinted myself, but learned a little bit that way.
Yes, and I admit that I had a heat stroke experience with my dog last September and had to take her backpack off and didn't have enough water and things like that. So it does happen even when you think you are prepared. So.
Yeah. Yeah, and I found myself sometimes on, out about hiking and you see a dog that you're worried about heat stroke. It's like, oh, do I say something? I'm like, yeah, you might feel like you're an idiot, but if you can save a dog, why not? And so I'll stop and, kind of engage in questions. Boy, it looks like pretty hot. Do you need water? Oh yeah, my dog did this once and my vet said it was, heat stroke and stuff. So, stop and engaging with people, I think is okay to do. I really do. A group of the nurses and I were talking about, like when you see a limping dog, it's like, do you stop and ask? I think it's good. Do you know your dog's limping? Sometimes people don't. One of the things I see on hot days here is when the pavement's really hot, and if people are involved, probably the best things like outdoor festivals, street fairs and stuff, and the dogs are starting to kind of dance like this, and owners are like, hey, I'm trying to buy this jar of olives, It's like, oh, I think your dog's feet might be hot. Oh yeah, pavement's really hot. So be an advocate. Don't be a jerk, but be an advocate.
That's really good advice, because people are usually operating from ignorance, not, they just don't know. So we do have a few questions coming in. One is, will we be getting all the information on the slides? So
kind of a condensed version with some of the normals and things, but but it's not all the details, but a condensed version, yes.
Okay, great. And then Wanda Vollmer, who gave our emergency preparedness talk last quarter, says, thank you very much. It's a wonderful presentation. She had a question regarding limping, and I'm not sure we can answer this clearly, Wanda, but her question is whether there's a correlation between limping and brain tumors, which...
If your brain tumor is in an area of your brain that governs your walking, because there are certain areas that govern the walking and the perception of where your foot is in space in areas of the brain, yes. But it's going to be kind of up in the brain, and it's probably not a pain related thing. It's more of a balance coordination thing.
Okay, that's great. And then one other question, what about dogs left in hot cars? Which
it is legal in California to break a window. So you can call 911 and say you've got a dog in a car, and the police can come and they can break the window to get the dog out. You can break the window to get the dog out. You can also run in the store and say, I think, someone's dog is here. There was a couple of comments by Tesla owners, because Tesla has dog mode. So you put your Tesla on, you put the air conditioner on, you don't hear the car on because it's electric. A couple Tesla owners with dogs inside had their cars broken into. And so this one guy I thought was pretty clever. He left his dog in, put his car on dog mode, so air conditioned, and he can monitor the temperature inside with his Tesla app. And then he taped a sign to the window saying, don't worry, it's in dog mode, AC is on. He's listening to his favorite tunes, kind of make fun. So we got to be a little careful with electric cars, because they may have the air conditioning going and it may be just fine.
And actually, the screen on a Tesla, if you put it in dog mode, it'll actually say on the screen now, if you can look in, it'll say, don't worry, I'm in dog mode, and it'll say the temperature of the inside of the car. So the big kind of computer looking screens will actually have a reading of the temperature. So that is a good thing to know, at least for Teslas.
Yeah.
So, and then we had one more question, and I'm not sure we'll be able to answer this, but it's tick season. Any ideas for what to do when you're out hiking, camping, and walking with your dogs?
Yeah, so we get lots of ticks where I am, and it's hard to find a tick repellent that's 100%. You know, ticks are just so primitive, I guess. So the best thing to do is just do a daily check for ticks and remove them as they come. So you can get these little tick removers, you know, like on your keychain that you can put against them. It's like kind of like taking a nail out with the end of a hammer. My favorite mode is I agitate the tick for about a minute and a half. And so if you see the tick there, you just flick back and forth really, really fast on it. And the dogs, they don't really like it. This is an embedded tick because it hurts a little bit, but you can usually sweet talk your dog through it. But even a hungry tick eventually gets tired of being hassled. And so if you do that for like a minute and a half, and then you pull it out, they have loosened their jaw grip, and you can usually get them out without leaving the head behind. But it takes a minute and a half or 2 minutes of pretty intense tick agitation. And, you know, again, it's just flicking back and forth with your finger, not like a poke, but like really worrying it. The other thing, I'll go back to the car because I realized, you know, if it's you and your dog, don't leave them in the car. You know, take them with you, tell the store, I've got my dog because it's too hot. I leave my dog home all the time rather than doing the fun outings because it's just too hot. So 85, 80 degrees and over. Actually, when the spring, it was just the first few warm days, that's when we see the most heat stroke in the emergency clinic because people aren't geared in yet and it's not that hot. It's those 80, 85 degree days. You're kind of forgetting you need to park in the shade or even you're there in the shade and shade moves or something. So it's just, they will have much more fun being safe at home than being too hot in a car.
And yeah, and it's unpredictable. I agree.
Yeah.
All right, we have one more question, and I should know this. Any side effects for dogs given the vaccine for the rattlesnake vaccine?
Yes, there can be. I don't know all of them. So talk to your vet that gives that regularly about the pros, cons, and risks. Again, I decided to do it because she's such a, okay, I had poor control over her when she got into her chase the cow, chase the snake mode. You know, it's probably going to be allergic reaction. I don't know them all.
And yeah, I haven't, in my minimal experience with it, I haven't heard it's not like some of the vaccines, like leptospirosis in the beginning was very high incidence of reactivity or allergic reactions. And I haven't really seen that much. And a very similar thing, where you live, the proximity to rattlesnakes, and the trainability, the recall, and the kind of common sense of your dog determines whether you want to go vaccine versus aversion or something else for preventing the bites.
Yeah. I didn't talk about foxtails that much, but they're out and about now. I am a big fan of the Outfox hood for dogs that are going to be off leash and around those. So I do. They're a little pricey, but again, they are a quarter of the cost of veterinary care for removing them from noses and feet. Yeah,
and I actually use Outfox for very pica-driven dogs for whatever reason, as long as they don't eat the Outfox net. But it does help for those dogs that have a tendency to pick something up and swallow it before you can get it from them.
Yeah.
So.
And if you check your dog's feet, probably just once a week, even is going to be fine for foxtails. You know, at the end of the walk is great, maybe twice a week, because it takes a while for the foxtail to actually, and this is a dried grass plant material that's barbed, microscopically barbed. They get in between the toes, but it's going to take them a while to really work their way in. So if you can look in your dog's toes at least once a week, you'll probably avoid those injuries. And around the anus and tail folds, they can also occur there. And so again, get your dog used to you looking at the feed. Do it when it's not a high stakes time and give them lots of treats while you're doing it. Get them used to that.
Yep. And just like the e-collar, a good thing to start when they're puppies. Play with their toes, look in their mouth a lot, put an e-collar on them, and make it all fun and games. And maybe not all at once, but slowly. Yeah, those are great tips. We've got a lot of positive feedback. Everyone's saying, thank you so much. Great talk. So really, really appreciate you taking the time, and very thorough.
Thank you. Thank you.
Great. All right. Well, thank you everyone for attending, and go have fun, but be safe with your pets.
Indeed. Indeed. All right.
Thank you so much, Dr. Richardson.
Take care. Bye-bye.
Bye-bye.